If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, is there any alternate medicine or technique to cure type 2 diabetes? Answer by Dimmed Holdings. In some research studies, numerous substances have been shown to help improve insulin sensitivity. Other studies on these same substances have failed to show they have any effect on blood glucose or A1C levels. Since the findings are not consistent, there are no alternative therapies currently being recommended to help manage blood glucose levels. If you decide to try an alternative diabetes care, do not stop the diabetes care prescribed for you by your doctor. Be sure to ask your healthcare provider about any therapy you are considering to make sure it won't interact with your current diabetes care plan or cause an adverse reaction. There is no cure for diabetes. If you are currently taking insulin, don't stop using it unless your doctor has directed you to do so. But please don't use medicine without consultation. You can find a great doctor through location, specialty, conditions, treatments, procedures, insurance taken, and many other filters. Choose one with confidence based on experience, credentials, and unbiased review. Find a doctor online using T-Eamed platform. Answer by Arjun Panesar. You can certainly have a go at reversing it. How? Lower carb diets, increased exercise. A high carb diet is going to keep your blood glucose levels high as there isn't the insulin to reduce them, or at least it isn't as effective. So, by reducing carb intake, exercising more and reducing processed foods, they're just nasty, your blood glucose levels should begin to stabilize. And there are many people who have technically been diagnosed with type 2 diabetes, but have an HbA1c/A1C that would suggest that they don't. A small study by Nielsen and Johnson, in 2008, of 16 patients following a low-carbohydrate diet, 20% of energy from carbohydrates, showed a marked decrease in HbA1c over a 44 months period. The control group in the study consisted of 15 patients that followed a diet with 55 to 60% of energy from carbohydrate, including whole grain foods and fruits for snacks. Over this period, the mean average loss of body weight was 7.5 kilograms. The study also found that amongst the low carbohydrate group, cardiovascular events were reduced compared to the control group. 2 of the 23 following the low-carbohydrate diet had cardiovascular events, compared with 4 out of the 6 control group participants which did not change their diet over the study. The study reported that many of low-carbohydrate group were able to significantly reduce or come off diabetic medication. 2 of the low-carbohydrate group increased their carbohydrate intake after 22 months compared with 7 of the control group which switched to the low-carbohydrate diet. Have a read of this for more.